The mantra from government and school leaders when it comes to reopening schools is that they want to follow the science.
But what does the science say about COVID-19 in children, and why isn't the answer clear? Dr. Frank McGeorge is here with 2 new reports on how many children get infected and putting those numbers into perspective.
Yeah, Kim and Devin. So, my mom always reminded me never to argue politics or religion. Oddly, I am finding myself saying the same thing about the science of COVID-19. The issue is that while there are objective numbers in the data, everyone has their own take on what it means, especially when it comes to the emotion of school reopening. Here are the numbers from 2 new reports.
A new study published in the Archives of Disease in Children found that between January and May of this year, children, defined as being under 16, represented only 1.1% of SARS-CoV-2 positive cases in Great Britain. In the same time frame, there were 8 pediatric deaths, representing a case fatality rate of 0.3%. Additionally, using historic mortality data, the authors were able to show that there were no additional deaths that might represent undetected cases of COVID-19. In the end, the authors concluded that, quote, "Our findings provide further evidence against the role of children in infection and transmission of SARS-CoV-2. The data from that study should be contrasted with a recent report from the American Academy of Pediatrics and Children's Hospital Association. Using data within the United States, they found as of August 6th, pediatric cases represented 9.1% of all SARS-CoV-2 cases in the U.S. Back in May, when the UK study ended, it was only about 3%. The reason behind the rise in the U.S. isn't proven, but experts have noted 2 factors: increased testing in children, even if they're minimally symptomatic or asymptomatic, and generally increased spread in the community in both adults and children in recent months. Even with increased pediatric cases, according to the data, children represented between 0 and 0.4% of all COVID-19 deaths in individual states, with 19 states reporting 0 child deaths. That's compatible with the CDC's data showing that compared to 18 to 29-year-olds, children less than 18 have a 9 to 16 times lower risk of death.
Now, it's really important to understand this is what we know right now, and it's highly likely that we're going to learn more to refine our opinion over time, especially, frankly, as schools reopen. The bottom line is children do get infected, not nearly as often as people over 18, and definitely not with as severe consequences. The real question is, how much risk is reasonable? Back to you.
Yeah, that answer remains. Okay. Dr. McGeorge, we appreciate it. And we know many parents have questions, struggles, and challenges as they work to make the best decisions for their children. And that's why Local 4 is holding an Education for All town hall tonight at 7 on clickondetroit.com. Devin and Paula Tutman will be joined by education leaders to answer your questions. And to make sure your voice is heard, please submit your questions right now on clickondetroit.com.